the planning, organization, and control process of Mayo Clinic. The Mayo Clinic was birthed through the private practice of Dr. William Mayo. Dr. Mayo began his private practice of medicine in 1863 in Rochester, Minnesota. By 1888, Dr. Mayo's clientele grew, and he not only added his 2 sons as practicing physicians, but several other researchers and doctors had joined him in his quest for a medical practice that would pool together the best resources for the patient. In a time when doctors were primarily a one-man show, Dr. Mayo developed the first private integrated group practice in the world. Mayo Clinic may be found presently in its founder's location in Rochester, Minnesota, as well as in Jacksonville, Florida, and in Scottsdale and Phoenix, Arizona. The Mayo Clinic's mission statement is to inspire hope and contribute to health and well-being by providing the best care to every patient through integrated clinical practice, education, and research. And the primary value is simply stated as the needs of the patient comes first. In 2011, the Mayo Clinic's facilities cared for over 1 million people who traveled from all 50 states in the U.S., as well as over 150 different countries. To meet the demands of those who seek medical care at the Mayo Clinic, the clinic employs over 58,000 employees. When examining Mayo Clinic's mission statement and the way departments are separated within the hospital, it is apparent that Mayo Clinic has become a leader in quality management and an example for not only hospitals, but for other businesses. Mayo Clinic has received many awards and accreditations, such as eHealthcare, Leadership Awards, Platinum, Best Health and Healthcare Content, and Consumer General Health. Mayo Clinic has been recognized more than any other hospital by 8 of the most well-known national assessment organizations. The Mayo Clinic name is so widely recognized that it may be the only true national brand name in American medicine. Mayo Clinic is one of the most highly efficient run hospitals in this nation. It seeks to specialize in all areas of medicine and to be the best in the healthcare field. Mayo Clinic's handling organizational planning and control processes are managed from a bureaucratic standpoint. To perform planning tasks, managers identify and select appropriate organizational goals and courses of action. They develop strategies for how to achieve high performance. They also describe their control process as broken down into 4 steps: establishing standards of performance, measuring, comparing, and evaluating actual performance. The departments within the hospital include human resources, security, billing, volunteer services, family counseling, psychology, sports medicine, as well as other specialties. Currently, the human resources team at Mayo Clinic is a major player in helping maintain and build a culture of teamwork. Workforce planning, employee recruitment and selection, training and development, compensation and benefits, and performance management are key areas in which human resource strategies are used to develop and reinforce Mayo's model of patient care. Each department has its own timeline and bureaucratic structure for management purposes. This structure ensures that all departments are micromanaged within the whole of the entity that is the Mayo Clinic. Outside the departments, there is a macro management structure that is responsible for overseeing the leadership of each department. This structure is responsible for making the managers of those departments responsible for the efficiency and expediency of the processes that are used to meet the requirements and objectives each individual department was created to handle. This hierarchy system described is very efficient at managing the business and people of Mayo Clinic. There are no recommendations our group can make to improve this process, and the results produced are evident within the productivity and success of Mayo Clinic. Diversity is highly valued and recognized within the Mayo Clinic. Workplace diversity refers to the characteristics that distinguish individuals or groups from one another. For example, distinguishes based on race, color, gender, religion, age, sexual orientation, and natural origin. The founders and brothers of the Mayo Clinic, Dr. William Mayo and Charles Mayo, understood the value of bringing together people with diverse talents, backgrounds, and beliefs to best serve their patients. Their father, Dr. William Mayo, instructed that no one is big enough to be independent of others. The commitment to diversity is woven into Mayo Clinic's strategic plan through the clear objectives for education, communication, recruitment, and retention. The staff at Mayo Clinic helps to value and promote diversity. Mayo Clinic was rated 4th in 2012 for the Diversity Incorporation for Hospital Systems. At the Mayo Clinic, the benefit of the diversity approach is to offer a broad group of talent. The broadness helps create energy within the company, as well as contributing different viewpoints and perspectives in decision making. The initiatives and concepts are improved with diversity, and it better represents and responds to Mayo Clinic's patients and colleagues. Mayo Clinic also has a diversity oversight committee, which serves for the creation, prioritization, and the oversight of the diversity goals and objectives at Mayo Clinic. This committee helps promote the diversity between the staff and patients. Mayo Clinic also launched a community outreach program called Live Well, Be Well, with the goal to promote and provide health education in the minority communities. In 2009, the program had impacted approximately 5,000 community members through the educational forums, community events, and other outreach events that took place. The minorities' participation rate went up from 7% in 2004 to 21.4% in 2009 in the cancer clinical trials alone. Mayo Clinic has developed a well-rounded plan enabling different people to be involved within their community. Promoting a healthier community not only helps the members of the community, but through these community initiatives, Mayo Clinic is able to interact and conduct research involving races, gender, age, and religion, which benefits the community as a whole. Since Dr. William Mayo first valued bringing people together with diverse talents, his attitude to create diversity led to the Mayo Foundation that would become known nationally as a state-of-the-art facility. The Mayo Clinic is the most innovative, well-respected, and sought-after group of hospitals and research facilities in the United States. Its commitment to quality of care and strategic management with a diverse workforce makes it the most highly efficient run hospital in this nation.